The Republican Party has decided to go all in on their effort to kill health care reform in this country. If you've been following the health care debate even a little bit over the past month, you've probably heard President Obama calling on Congress to vote on health care reform before the August recess, before members of Congress go home to their districts for the whole month of August. Why does the timing of this matter? Why was the president so insistent on getting something done before lawmakers leave D.C. for the month? Well, today we learned that during the recess, the Republican National Committee will spend $1 million over the course of just 1 month campaigning against health reform. $1 million to offer their own health care reform idea? No. $1 million to suggest Republican alternatives to the Democrats' plans? No. $1 million to stop the whole idea of health care reform in its tracks? Ding, 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 ding. Yes. Over the course of the next month, the Republican National Committee says it will blanket the country with TV and radio ads attacking health care reform. The ads will reportedly run in 33 states, denouncing the whole idea of changing the health care system as dangerous. Now, Democrats have 60 seats in the Senate. They have a huge majority in the House. Because of that, ultimately, it's on them to get health care reform done. But Republicans are doing their darndest. And even as Democrats split and split and split on this issue, Republicans have carved out a singular, unmistakable role for themselves here. They aren't just trying to be a speed bump on the way to health care reform. They're trying to be a spike strip. They're trying to stop the whole idea of it dead. Why exactly are they doing this? Well, presumably, they think it's a good way to hurt President Obama, to chip away at his political capital, to make him fight a long battle that's almost impossible to win, and hopefully he'll lose, and his first term will get all swamped in the process. That's the obvious politics at work. But maybe there's something else going on here, too. Have you noticed that when Republicans talk about why health care reform is such a dangerous idea, they keep citing the same sources over and over and over again?
According to the Lewin Group, 119 million Americans would lose the private coverage that they currently have.
Lewin and Associates, a consulting firm, healthcare experts.
In fact, the Lewin Group did a study.
Well, the Lewin Associates, which is a very respected technical firm.
There's one study from the Lewin Group.
One firm, Lewin Group, is telling us
what you're going to have, according to the Lewin think tank that specializes in healthcare.
This Lewin Group is very influential among the Republicans. They are supplying tons of the Republicans' information about why health care reform is such a bad idea. Thank goodness they've got the Lewin Group to cite for research. You want to know who the Lewin Group is? It was reported in the Washington Post recently. It's the insurance industry. Specifically, it's one particular insurance company, United Health Group. United Health, one of the nation's largest insurers, operates a subsidiary that's called Ingenix. And Ingenix operates a consulting firm called the Lewin Group, which top Republicans call nonpartisan and independent when they use Lewin Group insurance industry talking points to make us all feel afraid of changing the healthcare system. And if the name United Health Group is making your Scooby News sense go all tingly, it might be because you remember United Health Group from your corporate crime blotter. In January of this year, United Health agreed to pay $400 million. That was the settlement, $400 million for essentially defrauding patients. The New York Attorney General's office accused the company of skewing data in order to shift medical expenses onto consumers. So if the Democrats really don't get health care passed before the recess, and that gives Republicans a full month to talk about what a bad idea it is to change the health care system because they love it the way it is and it would be so dangerous to change it, consider who exactly they're representing.
According to the Lewin Group,
Lewin and Associates.
One firm, Lewin Group, is telling us
there's one study from the Lewin Group.
Opposition to healthcare reform, brought to you by the people making a mint off the system being the awful way it is now. Joining us now is former Democratic National Committee Chairman, former Governor of Vermont, Dr. Howard Dean. Governor Dean, thanks very much for joining us tonight.
Rachel, thanks for having me on.
Let me ask you first about the premise here. My sense is that there is not a Democratic-Republican debate about how to reform health care. My sense is that it's more like Democrats think there ought to be health care reform and Republicans think there ought not be health care reform. Do you think that's true?
I think it's even deeper than that. I do think that's true. This is not even about Democrats versus Republicans. This is about the health insurance industry versus the American people. 72% of the American people want a public option. We want them to be able to make these choices. 50% of Republicans, grassroots Republicans, think they ought to have a choice. So anybody who votes against the public option is not just voting against the Democratic bill or something like that. They're voting for the insurance companies and against the American public. And that is going to be the cry in 2010. Well, who are you going to vote for? The people who sent you there and you pay their salary? You're going to vote for the health insurance industry. That's your choice.
Well, the Associated Press and NBC News are both reporting tonight that a bipartisan group of senators is making some sort of progress on some sort of compromise bill, but it wouldn't include this government insurance option. It wouldn't include the public option, and it wouldn't require businesses to offer coverage to their employees. Now, we've heard a lot of reports along the way about what's going to be in the bill or what's not going to be in the bill. What's your take on this latest news?
Well, that's all very nice. I'm glad they're bipartisan, but that's not health insurance reform. That is insurance reform, but it's not health reform. It's not going to. What it will do, I assume there's guaranteed issue and so forth in there, and if that's true, if the guaranteed issues in there and community rating, then it's insurance reform. It's not going to do anything to curb expenses. It's not going to change the health care system. It's not going to insure anybody extra. That's what I call the fake public option, and it's a shame, really, because the Democrats are going to end up being responsible for killing this bill. If we stick together like the Republicans are, we can get this passed, but unfortunately that doesn't seem to be the case.
I feel like it's not surprising to see the industry, the people who profit from the system being the way it is now, trying to stop anybody from changing the system. It's working great for the insurance companies right now. But how do they get politicians, Democrat or Republican, to make that case for them? Is there an ideological fit here, or is it just campaign contributions, or what is it?
It's just about it's about money. It's about money, because when you have 72% of the American people thinking that they should have the choice instead of Congress, this is about money. And the health insurance industry gives out a lot of money. And, you know, this is going to be a hell of an issue in 2010 because, you know, honestly, what's the point of having a 60-vote majority in the United States Senate if you can't produce health insurance reform out of it? Or excuse me, health care reform. You can get health insurance reform. This bill is going to cost a lot of money, and it isn't going to do anything if this compromise is so-called compromise is true. This compromise does nothing except it will reform insurance. That's a good thing to do, but they ought to strip the money out of it, because we reformed insurance like this in Vermont 15 years ago. It's a fine thing to do, but it doesn't insure more people.
If the problem
it does make it fair. It's not worthless because it makes it fair, but it's not health care reform, and nobody should pretend that it is.
As you said, the Republicans, as you implied, the Republicans are very unified on this, and it seems to me like their strategy is that they don't want anything to change. And as you point out, it's not just a Democratic-Republican divide. There's also a divide within the Democratic Party, and you can trace that divide down to where the insurance industry's influence is. So what can happen within the Democratic Party to hold the Democrats together, to make conservative Democrats and those allied with the insurance industry do the right thing?
Well, some conservative Democrats are doing the right thing. I don't mind the Blue Dogs holding the feet to the fire on issues like fiscal responsibility. I think that's good. What's bad is coming out against the public option, because that's what their constituents want. This is, again, not a conservative liberal divide. The constituents want a choice. They're tired of politicians telling them what to do. They're frankly tired of insurance companies having bureaucrats tell their own doctors what to do, which is what's happening now. The Republicans are completely bankrupt on the issue. Half the things they say are just not true and made up by spin doctors. So the question is, will the Democrats reform health care, or will they not reform health care? The House did a great job. The Health, Education, Labor, and Pension Committee did a great job. The Senate Finance Committee is really in trouble. And if this is true about this so-called compromise, I fear for the future of health care reform, because that's not health care reform.
Well, what I really want now is I want you to host Countdown tomorrow night and Wednesday night on MSNBC, so you can keep sort of helming this coverage. Will you do that?
I will, actually. That's a good suggestion. I'll go right over and see if I can arrange that.
Excellent. Former DNC chairman and former governor of Vermont, Howard Dean, who will be hosting Countdown tomorrow and Wednesday night. Really looking forward to seeing you then, Governor. Thanks a lot.
Thanks for having me on.